Hello, everyone. My name is Jason, and I'm going to be discussing disabilities as a whole in the United States as my topic. Disability is important because really it affects each and every one of us, whether it's a family member, whether it's us personally. It's striking when I was looking at the numbers. Actually, 61 million Americans are affected by disability. um, which ended up being 26% of the population and equaling one in every four adults in the US are have some kind of disability. And we're all at risk of either having a disability at some point in our lives, whether we're just born or whether we're close to dying. At some point, we're very likely to have some kind of disability that affects us and affects our lives. This picture over here on the side shows a lot of, or some of the things that make it a little bit more predisposed um, as far as those that have a disability, or in addition to um, a comparison of the people with disabilities, for example, that are obese, and those of the population that are without disabilities, those that are smokers and have heart disease and have diabetes, which is pretty significant as well. And comorbidities are definitely a part that can give us more disabilities or make us more at risk for that, which is kind of what I'll talk about a little bit here. Some of those populations that are more at risk are African Americans, especially in the South. And then it goes to Native Americans and Alaskan Natives. As in addition, those that are in poverty or rural areas, which I assume a lot of the first reason could greatly be dependent on diet as well for the African Americans and Alaskan Natives. Um, the elderly, where there's two in every five adults age 65 or older that have a disability. Women are more at risk. One in every four women has a disability, and comorbidities as well can be a high contributor of disabilities. These compounding comorbidities are really changing people so that they basically have a super difficult time just being able to complete their ADLs and their tasks throughout the day. Some additional or some social determinants would be geographic location, economic status, race, gender, ethnicity, and age. A lot of them coincided with the most at risk factors. I threw in this little picture as well that I was kind of um, learned something new about. So the disabilities by age in the lower right hand corner, you know, the largest population is the elderly population. However, um, they are not the highest percentage because of population size in that category. So, for example, 18 to 64, there's 53% in that age group. However, there's a lot of people in the 65 years and over bracket, so it kind of makes the numbers slightly skewed. But I mean, there's a lot of people age 18 to 64, which is in our current age group for most of us in this class, that will be affected or can have the opportunity to be affected by some kind of disability. So we have to be careful. I found this picture interesting. Some of those social determinants and economic status and some of these causes of disability, where it be more from trauma, or it could be a genetic composition. Some of the impairments to that are understanding, motor skills, so physical, mental, um, or a lot of those. The socioeconomic ones where stigma is a big thing with disability. A lot of people that are disabled are discriminated against, harassed. There's a lot of abuse and violence with those that are disabled. They're definitely victims of that. Their communication is definitely, those with people with disabilities have a harder time with that. And a lot of them live in poverty because they have a difficult time making money because of their disabilities. Some of the lifestyle factors that are affected, some of it is nutrition and diet. Some of it's the sedentary lifestyle and being isolated, um, and their personal loss of control. And a lot of their dynamics is in their families can really affect their overall health. Sometimes it's the parent stress or the mental stress or disability that is really taking over. A lot of them have to be looked after. They have to have special schooling, and it's it's really compounds when you look at it all together. A lot of people really don't grasp or understand that. Some of the types of disabilities, and you can see it for yourself. This is kind of broken down into categories of what percentage of the adults have what kind of a disability, whether it be mobility, which is 13.7, cognition 10.8, um, the 6.8 for independent living. So they're living with a disability or difficulty doing errands, hearing or deafness, vision or blindness, and even those, they kind of threw in some of those numbers, some of those that even just have like really strong prescriptions or as well into that. And then 3.6% of the population just have self-care issues and have difficulty bathing or getting dressed and really need assistance with that as well. Why should we care? A lot of the pictures that I put in here, these people with disabilities, and some of these I didn't, it's harder to show some of the mental ones in these pictures, but these are people. These are people with lives, and some of these individuals that have disabilities do the best they can, or some of them don't realize that they're disabled because of their mental disability. But just showing some of the physical side of these things, that anybody can be affected. The death rates are higher for those that in the general population that have a disability. Um, some of the statistics were coming from Social Security, and as we age, the disability rates increase. And I had to put Superman on there just because we all know that he suffered a great disability and he played the role of Superman. So it's kind of shows us that really anything can happen to anyone, and our lives can be changed. What can be done? A lot of education and promotion of healthy living as providers, uh, and as a general population. Most of the general population really doesn't understand, or as a whole, we don't understand as people something that we haven't gone through. And so, to the extent of there really needs to be a lot more education as far as so people have a more wholesome understanding, and maybe we can end some of the bullying and some of that goes on, or the discrimination, especially that tears these people that have disabilities apart. They feel like nothing. A lot of them have depression because of that. Um, Helping monitor the data so it's appropriate and on point. researching and reducing health disparities, also building an inclusive health program that really, the picture on the side here just kind of shows some statistics as far as how long does it really take to get a diagnosis just on average, or go from having issues to kind of getting that diagnosis and um, and waiting on, and this is just talking about learning disabilities. Improving the time of the diagnosis and continuity of care, and improving access to healthcare. A lot of people that are in poverty that are disabled and they can't afford healthcare. Some of them agencies are able to they're able to be approved for some of those things, but a lot of people don't know, and this is something that I have found out just from personal experience, is that unless you work 5 out of the last 10 years and sequentially um, in that time frame before you actually apply for disability, you will actually not get full disability unless you have worked 5 out of those last 10 years. So let's say you were a housewife, or and you had been taking care of kids for so many years, and you worked here and there for let's say maybe even just 4 of the out of the last 10 years, or you worked part-time and you didn't pay into Social Security enough, you would not be eligible for full disability, and it would actually be, you'd be eligible for what they call SSDI, or it's based on income level, so of your spouse, or if so, depending on that, some people can't qualify for full disability, and this is something that really needs to be addressed, because these people aren't able to qualify for disability, and some of them aren't able to qualify for Medicaid either, and it really puts a hinder. Their life's already pretty difficult. And I just wanted to share some of the references that were used in this, and I appreciate you taking the time to listen to this, and I hope you learned something new. Thank you so much.